Is it safe for everyone to use cannabis during cancer treatment? Hi, my name's Mary Johnson. I'm a registered dietitian and owner of Healing Food for Cancer. And in today's video, which is the second in a series, and I'll drop a link in the description below to the first video. In today's video, we're going to explore some conditions where people shouldn't use cannabis. And I want to just share a caveat right off the bat that I think it's essential that if you decide to use cannabis during treatment, that you disclose using it to your care team. It's really important that they know so that you can be sure that there are not going to be any unwanted interactions between the cannabis and the treatment that you're receiving. There are a number of conditions where you absolutely should not use cannabis, and we're going to talk about what those are today. If you have allergies to cannabis, its analog, constituents, or delivery vehicle, it is something that should be avoided. So if you're allergic to CBD or THC or something like the sesame oil that's used as a delivery vehicle, it's not something that should be used. The second is cardiovascular and lung disease. There can be some really serious consequences, including death, if you use cannabis and you have cardiovascular disease. There may be the possibility to use cannabis if you're not smoking it if you have lung disease, but that is definitely something that needs to be carefully considered with your care team. The next is if you are using any form of pharmaceuticals that would have an interaction with cannabis. So that's something that discussing its use with your care team will reveal whether or not there are any potential drug interactions. The next is whether you have any psychiatric issues, whether it be something like schizophrenia or a family history of it. It's something that should be avoided. It's not appropriate for individuals who are 25 years old or younger if it's being used in the form of smoking it. It's also inappropriate for individuals who have either liver or kidney disease, since the liver metabolizes the cannabis and the kidneys are involved in excretion. It may either amplify or prolong the effects of the cannabis. It's also not appropriate if you're someone who's trying to get pregnant, who is pregnant, or who is breastfeeding. It can create a set of circumstances where it's harder to conceive, where if you are expecting, where you run the risk of developmental issues for the fetus, as well as it is something that can be passed along through the breast milk. So definitely something to be avoided if you are trying to get pregnant, are pregnant, or are breastfeeding. If you have chronic hepatitis C, it is also something that should be avoided. If you're someone with anxiety, it's very important to know what the appropriate dosage as well as the appropriate form. So some forms can increase your anxiety, while some forms such as THC can help to reduce anxiety. Precautions should also be taken if you are on benzos or opioids. So again, consult your care team. So there you have it. Those are the conditions that create a set of circumstances where it is not advised that you use cannabis. Now, that's not to say that your care team might advise you to avoid using it if there are other things going on. So please reach out to your care team, have a conversation about whether or not it's appropriate and what the most appropriate form for you will be. I hope this video has been helpful. It is not intended to be a substitute for one-on-one care. Thank you so much for watching. Please subscribe if you'd like to know when I release future videos in the series. And if you'd like to learn more about working with me one-on-one, please visit my website at healingfoodforcancer.com.